Kidney and urinary function. The kidney and urinary system include the kidneys, ureters, bladder, and urethra. And urine is formed by the kidney and flows through the other structures to be eliminated from the body. So here are the learning objectives. Kidney and urinary systems regulates fluid and electrolytes, removing waste and providing hormones involved in red blood cell production, bone metabolism, and control of blood pressure. Structures consist of kidneys, ureter, bladder, and urethra. Now, the ureters are long fibromuscular tubes that connect each kidney to the bladder. The bladder is a distendable muscular sac located just behind the pubic bone. The urethra arises from the base of the bladder in the male and passes through the penis. In the female, it opens just anterior to the vagina. Here's a good picture of the kidneys, ureter, and the bladder, which is together the circulatory system. Make sure you guys familiarize yourself with the anatomy of the kidney. So the nephron. The nephron is the structural and functional unit of the kidney responsible for urine formation. The glomerulus, which is within the nephron, is the tuft of capillaries forming part of the nephron through which filtration occurs. The glomerulus is a unique network of capillaries suspended between the afferent and efferent blood vessels, which are enclosed in the Bowman capsule. This picture gives you a little more insight on the physiology and pathophysiology of the formation of urine. Make sure you guys pay attention to those pictures. They're very good at explaining everything in depth. The function of the kidney altogether includes urine formation, excretion of waste, regulation of electrolytes, regulation of acid-base balance, control of water balance and blood pressure, renal clearance, regulation of red blood cell production, synthesis of vitamin D, and then also secretion of the prostaglandins. Now, formation of urine has to do with the glomerular filtration, tubular reabsorption, and tubular secretion. And we'll get into that a little bit more in our lecture. Now, to get into the renin-angiotensin system, activation of this system increases the retention of water and expansion. This complex system is activated when pressure in the renal arterioles falls below normal levels, as occurs with shock, dehydration, or decreased sodium chloride delivery to the tubules. Our body also has autoregulation of blood pressure, which starts the renin-angiotensin process. The regulation of blood pressure is an important function of the kidney. All right, now to get into the gerontologic considerations. Older adults are susceptible to kidney injury because their renal structure and other functional changes occur as we all age. Upper and lower urinary tract formation or function changes, the sclerosis of the glomerulus and renal vasculature change, decreased blood flow, decreased glomerular filtration rate, which starts between 35 to 40 years of age. Also altered tubular function and acid-base balance. And acute and chronic kidney injury, both can be due to the structural and functional changes in the kidney. And it's just because those changes can sometimes just make the risk even greater. Renal function usually becomes or usually remains adequate. Renal reserve is decreased and may reduce the kidney's ability to respond effectively to drastic or sudden physiologic changes. Older adults are more prone to develop hypernatremia and fluid volume deficit because increasing age is also associated with diminished osmotic stimulation of thirst. So they also have, you'll also hear a lot of them complain of incomplete emptying of the bladder, urinary stasis, decreased nerve innervations as well. And then also the decreased drug clearance, which will cause them to be at an increased risk of drug interactions. Okay, diagnostic studies. There are a lot of diagnostic studies. Renal function tests are used to evaluate the severity of kidney disease and to assess the status of a patient's kidney function. So, with urinalysis and urine cultures, those are probably going to be the ones you see more often. They usually do a kidney, ureter, and bladder study, which altogether is called a KUB. And it's performed to look at the size, shape, and position of the kidney and to reveal urinary system abnormalities. Let's see. Ultrasonography. That one is non-invasive. It uses sound waves that passes through the body through a transducer, and it could detect abnormalities of internal tissues and organs. It looks at like masses, fluid accumulation, congenital malformations, changes in the organ size, or obstruction. And then you have the CTs and MRIs, which you guys probably are accustomed to. Those are non-invasive, and they provide excellent cross-sectional views of the anatomy of the kidney and urinary tract. There's other nuclear scans, endoscopic procedures, which are more internal, biopsies, which are sent out, IV urography, retrograde pyelography, cystographies, which are more pictures and views, renal angiography, and then a lot of the other ones you can see on the chart 53-4. 53-5 also has some tests, and it will explain the purpose and the normal values of like the 24-hour urine, which detects and evaluates progression of kidney disease. That's very popular in the hospital. And then also the that same chart will just go over creatinine levels, BUN, and then the BUN creatinine ratio, which evaluates hydration status. During most of those tests, the lower abdomen and genitalia will be exposed. So it's just important to remember to keep the patient have like make sure that they have their privacy and that they understand, that they may be exposed, so that way they're not it's nothing is unexpected causing any more anxiety, which leads to the nursing process, the care of the patient undergoing testing of the renal urologic system. Let's see. So patient knowledge. We have to make sure that they have an understanding of what's going on. Just explaining um, why they'll need the procedure, what to expect, and then psychosocial and emotional factors such as fear and anxiety. Just talking to the patient through the procedure so they know what to expect. It'll help ease that fear and anxiety for some. Um, Explaining to them that we're looking at the neurologic function, which will help to explain if they are having any issues with voidings. And it'll also help them to understand anything else that may possibly be going on urologically. Fluid intake. Some procedures require that their bladder is full. Some require that their bladder is not full. So that just depends on the procedure that they're having. And then hygiene, of course. Presence of pain or discomfort, just so that they're aware if there might be any pain or discomfort prior to the procedure. And then making sure that they don't have any allergies to anything that may be used during the procedure. Patient goals include understanding of the procedure, tests, and what to expect. That includes their family, especially if it's a pediatric patient. Decreased pain and absence of discomfort. A lot of times they'll use analgesics or antispasmodic medications to help with this decreased apprehension and fear. And then patient education, of course, providing a description of the test and the procedure in a language the patient can understand. More considerations. Let's see. Encouraging fluid intake unless it's contraindicated. Instructing the methods to reduce discomfort, such as sitz baths, also relaxation techniques that can be used. Administering, like I said earlier, the analgesics or antispasmodic drugs. Assess voiding and provide instructions related to voiding practices and hygiene, and providing privacy and respect. All right, that's the end of this one. It's pretty short. I'll go into more in depth in our lecture. So next chapter will be 54.